hello, and welcome to the first edition of the LGBTQ of Northwest Indiana and the PFLAG Crown Point TV. And your hosts for today are Amari Victoria and Elizabeth Manning. Welcome to your own show.
Thank you, Bill.
Thank you, Bill.
And one thing, allow me to do something here, and we'll get right back after it. I see something that I've got to correct. Just bear with me a second. What we like to do is go through and have you talk a bit about your organizations and also what you have planned for the show.
Sounds good.
Okay. My name is Amari Victoria.
And I'm Elizabeth Manning.
We'd like to thank the Bill and Collie Show for providing us the opportunity to come into your homes with a show dedicated to everything LGBTQ.
Yes, thank you. So the LGBTQ Northwest Indiana and PFLAG Crown Point TV show will come to you every second and fourth Thursday at 11 a.m., except for today is at 10 a.m., and we'll focus on the Northwest Indiana community.
We would like to tell you a little bit about us. I'm a transgender woman who has been married to Elizabeth for nearly 8 years, and I'm a lifetime Northwest Indiana resident. I began my journey as a transgender woman in our 5th year of marriage, and I'm very fortunate that my wife has also embraced this new part of our life. At that time, I realized that both myself and my wife would need support and had to travel many hours just to get that support in order to provide support in this area. I founded and became the executive director of LGBTQ Northwest Indiana, a nonprofit organization focused on support, education, and advocacy for the lesbian, gay, bisexual, transgender, and queer community in Northwest Indiana.
And I'm Elizabeth. I am Elizabeth. I'm Amari's cisgender spouse. And there's never been any doubt in my mind that I would support her and be with her on this journey. Her discoveries actually opened up a burning passion for me, which is supporting and advocating for the LGBTQ and ally community here in Northwest Indiana, particularly ensuring that family members of the LGBTQ people get the support they need. I believe this will help them in turn support, affirm, and advocate on behalf of their LGBTQ loved ones. I'm the founder and president of PFLAG Crown Point, Northwest Indiana, and chief operating officer for LGBTQ Northwest Indiana. We founded these organizations, as Amari said, because we were traveling to Chicago and Michigan City and Goshen, and as you know, those are a little bit of a drive from here. I'm also the state liaison now for my company's LGBTQ Supportive Employee Resource Group, and it's been quite a journey.
In the coming weeks and months, we will discuss topics pertinent to the LGBTQ and ally communities.
We'll be talking with individuals around our region, as well as elsewhere in the state and the rest of the country. That's one of the wonderful things about Zoom. So many people have stories to tell and experiences to share, and we hope that some of those resonate with you. We want to showcase LGBTQ affirming resources and services here in Northwest Indiana, as well as educate everyone, the LGBTQ community, allies, and the general public about LGBTQ related topics.
Today we would like to talk to you about the effect of the coronavirus pandemic on the LGBTQ community in particular. I'd like to start out by talking, using some talking points from the Human Rights Campaign, in two documents which they produced in this time of the pandemic. I would like to give you a couple examples of what the LGBTQ community might have to face in getting health care. Here's a quote from a transgender woman waiting for her first physical in years. When I walked toward the woman's bathroom in the waiting area, the receptionist jumped up and and told me to use a McDonald's restroom down the street. I felt like leaving and never going back. Here's a quote from a gay man who was hospitalized for a lung condition. After I mentioned that my husband would be visiting me, the staff, who had been very friendly, turned very cool, and I saw a lot less of them, even when I really needed help. And a lesbian mother, after the birth of her first child, says, I couldn't believe it. As I walked back to see my partner and our newborn, an employee stopped me and asked me who I was. When I said, the other mom, she rolled her eyes and walked away saying, I don't believe this. Some statistics from the HRC in this document shows that 56% of lesbian, gay, or bisexual patients surveyed have experienced some type of discrimination in healthcare, where 29% of lesbian, gay, and bisexual respondents reported they believe that they would be treated differently by medical personnel because of their LGBTQ status. The statistics for transgender people are even worse. 70% of transgender or gender nonconforming patients surveyed have experienced some type of discrimination in healthcare, and 73% believe they would be treated differently by medical personnel because of their LGBTQ status. Also, in the transgender realm, they believe 52% believe that they would be refused medical services because of their transgender status. That's a bleak outlook for the LGBTQ community as far as health services are concerned. Also from the Human Rights Campaign, I would like to share some data concerning the population of LGBTQ people who are affected by the coronavirus pandemic. One of the reasons is that LGBTQ people work in highly affected industries. That includes restaurants and food services, hospitals, K-12 education, colleges and universities, and retail. And that total number of people is about 5.5 million. LGBTQ people are typically poor. They cannot always afford health care or take measures to ensure that they have health care. Another reason is that coverage gaps exist. 17% of LGBTQ people don't have any kind of health insurance at all, compared to 12% of non-LGBTQ adults. Paid leave is not available to many. Thereby, they can't afford to take off time for medical reasons. And older and youth face unique challenges as well. There are some health risk factors as well in the LGBTQ community that are a little bit different than in the non-LGBTQ community. There are respiratory risks. 37% of adults, LGBTQ adults, smoke every day, as compared to non-LGBTQ people at 27%. And 21% of LGBTQ adults have asthma, compared to only 14% of non-LGBTQ people. There's also other chronic risks when immune systems are compromised. LGBTQ are more affected. People who've had HIV or have HIV, people who have diabetes, have exacerbated respiratory problems.
I just want to jump in and say that these health issues aren't because these people are LGBTQ. It's because of the lack of acceptance and validation and advocacy by society that leads to these phenomena happening.
So I do have a question. So your feeling is, because you did speak with a lot of health issues that are underlying, for instance, the use of tobacco, maybe to relieve stress according to what they're having. And that makes them susceptible yet to other diseases, lung cancer, or, and they've advised people, since this COVID-19 virus does attack the respiratory system, they're advising people smoking is not good. But in the cases that you described, which are just horrific, the way people are treated in a medical facility, I get that. I totally get that, and but yet it makes them more susceptible to being infected.
Yes, considering factors like the more prevalent smoking in the LGBTQ community, that creates issues for them, more severe respiratory issues, and it affects a higher percentage of the population, the LGBTQ population. And they do have higher rates of cancer, like you say. That also complicates issues.
And stress, the impact of stress is noted. Once you undergo stress, PTSD, any type of mental health issue, it eventually affects you physically.
Yes, and then just the fear of seeking out medical help because of how, people are treated, not being able to work, not having the health insurance, all that really adds up to bad news.
There are some issues that are more specific to trans people, not to say that it's only trans people by any means. And this information comes from the COVID-19 response from transequality.org, a nonprofit organization. LGBTQ people, as we've spoken, have higher rates of HIV and cancer. They may have compromised immune systems. And according to a 2015 U.S. trans survey, trans people are 5 times more likely to be living with HIV compared to the general population. LGBTQ people, as previously noted, also use tobacco at a rate 50% higher than the general population. The coronavirus is a respiratory illness, and is especially harmful to smokers. Trans adults consider their health as poor or fair compared to the general population. More than 1 out of 5 adults have at least 1 or 2 chronic conditions such as diabetes, arthritis, or asthma. Fear of discrimination keeps many from going to the doctor, which is absolutely horrible. And the ways that this impacts the effect is stigma and discrimination make transgender people reluctant to get help. There are barriers to health access, such as lack of insurance, and just because of the discrimination, trans people have a tendency not to go see the doctor even when it's necessary. And existing health conditions mean more trans people live in a state of compromised health.
So other effects of the coronavirus pandemic, not so directly related to physical health, were you going to talk about mental health? Mm-hmm. Oh, okay, go ahead.
I have just a little bit of information from the Trevor Project, which is suicide prevention and education resource online. Has many aspects where people can actually get help.
Yes, designed for young people, but they've got a text line, a chat line, a phone line. They're very responsive.
And although youth and young adults are estimated to have the lowest mortality rates, they are not immune to the consequences of the coronavirus as it relates to mental health and well-being. Even prior to the pandemic, youth have been found to have a significantly increased risk for depression, anxiety, and suicidality.
Again, because of lack of acceptance and validation.
And these risks are even more pronounced for transgender and non-binary youth. So you can see that not only do the non-LGBTQ folks have these same issues, but the LGBTQ community has these issues at a larger part.
And then, what are you going to talk about the when they're stuck at home with non-accepting people? Yeah. So a lot of this problems with the stay-at-home directives. I mean, it's fine for some of us, but others are confined to quarters with abusive partners or families, and LGBTQ youth might be at a home where their parents don't accept them or maybe don't even know about them and their LGBTQ identity. Many people don't have the connections or the friendships, so the isolation can be have very severe effects.
Yes, and in light of, or in talking about the topic of homelessness, 20% to 45% of homeless youth identify as LGBTQ youth. And between the ages of 18 to 25, they have a 2.2 times greater risk of homelessness than their non-LGBTQ peers. These homeless LGBTQ youth rely on approximately 260 community centers across the United States for their needs and general well-being. And of course, during this time of the pandemic, many of those are closed and operating at a reduced capacity.
And there are none of those in Northwest Indiana at this point, which is one of the things we'll be discussing further in another episode. So, yeah, pretty sobering effects for everybody. But, when you look at these statistics and, these companies that Amari's been reading from or quoting from are very reputable. And, they have valid research. And this lack of support and the increased risks are just some of the reasons that Amari and I are doing what we're doing here in Northwest Indiana. Just be able to provide support and offer resources, connect resources, refer to resources, identify resources, that type of thing to help, not just during these times, but in regular, if there's ever going to be such a thing in regular life, to be able to help people out.
Right. Go ahead. I'm sorry.
Go ahead, Bill.
No, what I was just the additional commentary on that is that, we're all of the duress that everyone is going under. There's a second layer for your community that is already going through some stress with acceptance, with, just obtaining equal and fair health care. It is just a crying shame in this day and age that we're having to deal with those issues, and where we were, we should be going down a path of acceptance and understanding people's identification and understanding, what we need to survive as humanity. Be quite honestly, and identifying with each other as humans and moving on with society. But it just tugs at my heartstrings to hear this going on in a community that should not be prejudiced against. This is, there are other things to be greater concerned about in our challenges with humanity than this. And everyone should have fair and equal access to health care. No one should take prejudgment about people's disposition on their need for health care. We need to get to that point. So Boy, as I'm listening to this, we're so happy to be hosting this for you, but at the same time, it is, it's stirring to hear some of these things. But that's my commentary, so I'll sit back and listen.
Regarding that specifically, you may or may not know that the Human Rights Campaign does a thing called the Corporate Equality Index, which judges companies, corporations, on their policies about LGBTQ support within their organizations. They have a comparable index called the Health Equality Index, where they've judged 680 organizations across the United States that have 10 or more facilities. And there are only 4 facilities or organizations in the state of Indiana that actually scored 100% on in this index. And those are, unfortunately, none are local. The VA Northern Indiana Healthcare System in Fort Wayne, Eskenazi Health, and the VA Richard L. Routbush Medical Center in Indianapolis, and Indiana University's Health Ball Memorial Hospital in Muncie, Indiana. Mm-hmm. There were medical organizations that are big in this area that weren't even included in this list of organizations, or they were and chose not to answer. And I do know the Equality Index for community hospital systems, that number is 55%.
I was just going to say, and it's not so much judging as it is evaluating based on a pretty robust set of criteria, both for the Corporate Equality Index as well as a Health Equality Index. So it requires a little bit of company participation, but there's certain standards that they have to uphold in order to be, ranked at a certain number.
A couple of examples of that are whether or not the organization has, I'll call it inclusion and diversity statements that include the terminology sexual orientation and gender identity. In one case, for the patients, something that the patients would have access to, and you can read those for many medical centers. They will have them, some will not be inclusive. And another aspect is whether or not they also apply those diversity inclusion aspects, characteristics, sexual orientation and gender identity in their policies concerning their employees. I don't know what the details were for community hospital, but those 4 that I did mention do have those policies in place, both for patients and for their staff.
Let me ask you, because there are some faith-based facilities in the area, and I didn't hear one of them on that list. Do you think that, without being judgmental, that some of those may score low on this rating scale because of the constant conflict of just your community and faith-based organizations?
So I would say that would be more likely. That is going to be another one of our episodes that we have is LGBTQ and faith. There are many, I'd say there's a very good handful of accepting and open churches in Northwest Indiana, but then there are many more than that that are not really accepting and open. The faith-based healthcare systems, that's kind of hard to make a blanket statement. I know each individual healthcare provider or doctor has their own philosophy and that type of thing. They have to toe the line, based on their organization, but I don't know enough details about the organizations yet.
Yeah. Okay. All right.
Medical professionals in those organizations, of course, have taken an oath to help
Mm-hmm.
people. Unfortunately, beliefs can get in the way of that. However, their oath should be stronger than their beliefs.
We feel.
We feel. Um,
Yeah, and that is a resounding factor. I mean, they do. I mean, doctors all take oath to protect people's health, regardless of race, creed, color, or sexual orientation. It should not matter, and it's unfortunate that we have some facilities that have, and maybe some are just not. They don't have their policies up to date. Especially now. I mean, I could tell you right now, all the healthcare facilities are trying to save lives, and boy, and the step back in their accreditation process, they already go through a rigorous process. And but yeah, I would hope down at a late, if this virus calms down and they can concentrate on their policies, they will be able to concentrate on this issue of providing fair health for all.
So that's one of the things that LGBTQ Northwest Indiana plans to do. Of course, we aren't doing it right now because of the situation, but providing education to healthcare professionals and healing arts professionals at all levels. Mari, do you want to talk a little bit more about that initiative?
well, that initiative is because as a transgender person myself, I do have fears about how I might be treated in any of these medical facilities. And I truly believe that understanding is very key to having people be able to accept LGBTQ people and treat them with respect and dignity, regardless of how they identify.
So it's not just like a blatant disregard or disapproval of LGBTQ people. It sometimes, many times, most of the time, it is a lack of education, a lack of knowledge, a lack of understanding. So, a front office staff member might not realize it's extremely horrific to dead name somebody in the waiting room or to out somebody in front of other people in the waiting room. But if they were just told that this is the situation, these are the effects, then they will be better able to make a good decision on how they actually treat somebody. So a lot of it is really just educating people, because educating leads to understanding. As Mari said, understanding leads to acceptance.
I think, in my opinion, there are many people and organizations at this point who are merely tolerant of LGBTQ people, and for LGBTQ people, that is not enough. Being only tolerant or intolerant, especially, is what causes especially trans folks to avoid medical care, because they fear things like dead naming or being outed, or treated with disrespect.
Or somebody, say a lesbian, goes into the doctor's office and with a broken arm, and the doctor might be more concerned or interested or questioning of their sexual orientation than they are of the fact that they have a broken arm. And that shouldn't be an issue.
No.
So just more education.
This term that you use, if you can, because some of us may not understand it, the term dead naming. What does that refer to? What type of practice is that?
Many trans people in particular change their names. Even I've done that. And a trans person can choose to change their name and have a preferred name, probably one that they plan on changing legally eventually. And what happens is, in the example of a doctor's office, when a form is filled out, you have to put your legal name. Some forms actually have a space for preferred name, but the exercise is to actually look at that preferred name and use it as opposed to the person's legal name.
so the dead name is the name they used to have, that they used to be called before they were their true self, and using their preferred name.
Okay. All right. I think I understand that. So they, does that cause insurance problems then? When they do that?
Yeah.
Okay, because
Yeah,
if I understand that, I'm sometimes I'm a little slow, especially
so
after
kind of
yesterday.
looking at two different issues.
Yeah.
The phenomena or the term of dead name is just a description of a person's former name that perhaps they don't want to be associated with anymore.
Mm-hmm.
And then just in practicality, anytime they get, well, especially when you're dealing with gender issues, it does affect it can affect insurance. It can affect, how you're treated in different places that have intake forms that maybe aren't so inclusive, that type of thing.
So let me understand this again. So what the practice is sometimes in the healthcare facilities is to take that preferred name and use it as it were a legal name. So when they submit for insurance claims, the insurance company is like, this is not their legal name. We can't process that. Am I drafting it out correctly? Is that?
That's one aspect. Another one is just if, for instance, somebody is being prescribed female hormones, yet they were born male or biologically male. Insurance companies are becoming smarter about all that or more inclusive about all that, but sometimes it does cause a problem, especially if somebody, say they were born male and they have not legally changed their name or gender marker. So legally, their Social Security, medical records, bank records, everything are in their male version, but then they're being treated for female hormones or other situations that just causes a disconnect in the traditional systems.
So that inappropriate medical practice may take place on the patient then, because they misidentified them according to the name.
And probably more so, Bill, than inappropriate practice being performed on them would be that they are not able to get a procedure or practice that they want or need for their new self. So.
Yeah, and talking about insurance companies and medical facilities, that is one complex area. So if they don't get this figured out to fight it and correct it, although this is fiction, there was one of the shows that Kelly watches where they brought this up. It wasn't having to do with gender identity, but it had to do with a procedure that didn't have a code. And the psychiatrist that wanted to identify this as a real issue with this person, that it had to fight the insurance liaison on how they're going to bill for this and whether they can actually conduct the procedure. And so that's just, but that's where we're at today. That's where we're brought at. There's this complexity of the insurance and the codes that are associated with procedures. Then you lay on top of that misidentification because of a gender identification issue.
So our organizations, a large part of what both LGBTQ Northwest Indiana and PFLAG Crown Point Northwest Indiana do is to advocate for better equity, better equality, that type of thing. But we also, we work at a higher level, like an organizational level, and that's where Amari wants to go into, and has already gone into a couple healthcare and healing arts providers, and either invited healthcare experts in, or does the education herself on LGBTQ issues and topics. Also trying to get into the education systems. There's been a little work done on this already in the area, but much more needs to be done to educate administrators, staff, teachers, um, principals, everything, on LGBTQ issues and the extreme importance of accepting and validating these youth. So those are two of the bigger initiatives that LGBTQ Northwest Indiana is going to do. But then on a human, personal, individual level, we both provide support. LGBTQ Northwest Indiana supports LGBTQ people directly. PFLAG Crown Point, in following with the PFLAG National chapter, was initially or originally designed to help families and parents, but now is expanded to be helping allies as well as members of the LGBTQ community. We are trying to create a thriving and robust community of LGBTQ people and their allies here in Northwest Indiana. Part of that is offering support, like Amari and I were traveling great distances to get. We both offer different support groups for transgender and gender nonconforming people. There's right now during this pandemic, we're also instituted some social hours. So Amari holds a weekly virtual social hour for transgender and gender nonconforming people. PFLAG Crown Point has the regular PFLAG support meetings, usually done in person, but now we're doing them virtually twice a month for the general PFLAG population, which are adults and older teens. But then we also have a teens program, and we have weekly social hours for them as well as a support group. Normally all these groups meet in person somewhere. LGBTQ Northwest Indiana, you want to talk about Eventual Community Center?
Yes, one thing that has actually been brought to light by this pandemic is that as an organization, both of us would like to be able to provide more to the community than we do already. There are things that we could be doing if we had a facility that we feel that we just can't at this point in time, and we have reached out to some organizations and made donations to them to help them survive this pandemic and to help serve the community. But we feel that we could serve the community directly better if we had some base of operation that would allow us to do that. I don't know. That's in LGBTQ Northwest Indiana's plan, 5-year plan. Have not grown enough to make that a viable option just yet. But I certainly will be pursuing some leads that I do have, and hopefully maybe we could put something together after this pandemic ends.
But to have an LGBTQ community resource center with meeting rooms, meeting spaces, library, books and videos, social events, all that kind of stuff. Very, very important. There's, I guess I'd like to jump into a little bit about what our upcoming programs might entail. But we are not the only support groups in this area or LGBTQ supportive organizations. We do want to go into more detail about what each of us offers, but there's other organizations like the Pride Initiative Group with Crown Counseling, the PRISM Teens Group in Valparaiso, PFLAG Michigan City, even the PFLAG Council of Northern Illinois. They have chapters all over and in the southern suburbs. Possible new PFLAG Valparaiso group. And so we wanted to go into a little bit more detail about all of those. We also put on the annual NWI Pride Festival. Last year was the first year. Amari and I were festival directors for that, and it was a very successful community outcome, so we were planning on doing it again this year. So it was scheduled for early June, but now it's not. Right now, it's scheduled for September 12th. at the Highland at the Lincoln Community Center, so it's indoors again. And of course, that's all dependent on how this whole pandemic situation, works out. We are in touch with all the other, or many of the other Pride organizations in Indiana, and we're all aware of the issues, and we're working together to determine the best route. Some of the Pride festivals have already been canceled, some have been rescheduled, some are still trying to navigate the waters. But again, we're rescheduled for September 12th. Michigan City, I just found out through Facebook, has been canceled. South Bend is evaluating how they want to restructure and when they want to do it. Fort Wayne is still scheduled. Well, that's not Northwest Indiana, but Fort Wayne is still scheduled for the late July, but they have a backup date plan just in case. New York Pride has been canceled. I haven't heard anything about Chicago Pride yet. But there will be also a virtual Pride put on by the International Network of Pride Organizations called Interpride, and that will be on June 27th. So as Pride Month gets closer, Amari and I do plan on bringing up more history and education and celebration for Pride.
The virtual Pride that will happen in June is actually 24 hours long and will contain contributions from Pride organizations all around the country.
All around the world.
All around the world.
Yep. Amazing. That's great.
Yeah. So that's going to be really, really fun. So we plan on talking about, in depth some more resources. Amari mentioned the Trevor Project, the Human Rights Campaign, or HRC. There's a wealth of others that would like to go into detail on and interview people from those organizations.
Both for the LGBTQ community and
as well as allies.
As well as allies, and some are very specific to the transgender community.
Mm-hmm. And last couple of years, we were part of a group that identified some what we call LGBTQ gap issues in Northwest Indiana. Things like the lack of LGBTQ homeless shelters or transitional housing, the lack of LGBTQ focused reentry circles for incarcerated people, foster care and at-risk youth issues. We talked about the community center, human rights ordinances in communities. Hammond has one, I know, and we are doing research into others, but we want to talk about that. And then PFLAG Crown Point is going to be rolling out a safe zone training program for local regional businesses. And then we have some contacts in the human trafficking business. We want to interview them. Talking about healthcare, mental health, showcasing resources. I'm talking about LGBTQ in education, in legislation, in legal services, with faith, with business, maybe different entertainment, and really to start building up and sharing a resource list of places that LGBTQ people and their allies can feel safe going to.
Yeah, when you use the word safe, it's disheartening.
I know.
No one should. We pray and hope for the human condition to improve, but and now I think we're attacking each other regardless of orientation and so on. So we'll see how we can get beyond this.
Oh, and just one, it's not just LGBTQ, but what we're realizing is it's all marginal communities.
Yeah.
So that, any inroads we make, any progress we make, hopefully we'll be able to help those other communities as well.
Mm-hmm. Intersectionality will be a topic of a future program.
Definitely.
Well, there's some complex issues here, and I hope we can get through them. I really do. I got to tell you, I'm so honored to host this and be able to provide a platform where you can discuss this publicly. And it just it's a beautiful thing, really it is.
Oh, well,
And
we're thrilled to be here and for you to be offering. So,
yeah, yeah. So this is great. Now, what else do we need to cover today? Is there some more that you want to go through?
just that anybody is welcome to contact us about the virtual meetings. I mean, there's at least 2 meetings a week that are going on for different people. So they're more than welcome to contact us to get that information. Um, we're on Facebook, Instagram, Twitter, web pages. I know you have all that information you're sharing, Bill.
Right. I not the some like the Twitter account, but I did put your both your websites and Facebook
Hmm.
pages on.
Okay.
Thank
And
you.
you can get to our social media through the web pages.
Right. Okay. Yeah, that's
So
great.
really just, we want to be here to help people. If you have any questions, any issues, um, struggling, not struggling, accepting, not accepting, want to know more, just please reach out. If we don't know the answer, we'll either get it for you or point you to the entity that does.
That's great. And as always, the community is stronger when they remain connected. And
Yes.
even in these times, that's why it's great that we found technology. Is it ideal? No, but it allows us to remain mentally connected till we can all get together again. And the one project that you're looking at is the community center. Boy, my mind just started thinking the videos that you wouldn't be able to find elsewhere, that even the library wouldn't handle. A resource center that is non prejudice, that people can take comfort, go to, and find materials that talk about issues specific to their orientation, to preference, what it be. And that just has got to be a comfort to future have that available, because it is, I hate to use your term safe, but it is an appropriate, a safe place for people to go and hang, and actually without any prejudice be able to communicate and interact with each other. That is a great thing. And anywhere, any type of climate, political, human, whatever. So that is amazing. And boy, anything we could do to help you out with that, please let us know.
Yeah, we've got a couple great role models in the center on Halstead and in Chicago, and then
Mm,
the LGBTQ Center in South Bend.
mm.
So they are both doing a wonderful job, and we hope to emulate some of what they do.
That's great. Yeah, I'm looking forward to that to you for you. That is amazing. So, boy, well, we probably should start wrapping it up,
Okay.
and this will be coming out in the future, and we'll keep you posted with our event schedules, and boy, I can't tell you how much we appreciate you for coming on and sharing this platform with us. It's going to help us all out. We're trying to help the community by providing resources even now, whether it's helping people out with stress, helping people out with the issues that you're talking about, and just helping organizations in general that are being literally stifled by this COVID-19 crisis. So, and we think there's going to be additional work to do even after this. Uh,
Absolutely.
and I think this, in actuality, has taught us all a lesson about humanity. It is interesting. And I had a thought in my head, and I'll share this. I don't. This is not preaching, but someone began talking about a theory of if there were a God, if there were a greater entity out there, how would one negotiate for humanity? And that is an interesting thought. How would someone negotiate with this higher entity? Um, and there's people that I would pick out, marvelous people that I would pick out. The Ryan, the Addisons, the 13, 12-year old that are servicing people that are in need, homeless people. Yeah, I call to that your organization, people that are helping people to become better. And that's what it's all about, and that's what we are so blessed to try to do, because we can only get better as humanity if we improve and follow an example. And so, with that, listen, I appreciate this, and appreciate your show. This is great. You provided a tremendous amount of information, And with that, we'll wish you both a very, very enjoyable day and the rest of the weekend. And we'll wrap things up and say goodbye for now.
Great.
Okay.
Thank you so much, Bill. We
We-
really appreciate
Thank
the Bill
you.
and Kelly show.
If you'll
We'd
stay
like to
on,
thank you and the
we'll
Bill
go
and
ahead
Kelly
and
Show.
wrap up the show, and I'll be back with you shortly.
Okay.